bring awareness to colon cancer. March is Colon Cancer Awareness Month, so today we're talking with Dr. Jeffrey Cohen from Hartford Hospital, and also Polly is here to talk a little bit about this. And you just started some chemotherapy, I believe, recently.
And radiation.
And radiation. So let's talk a little bit about colon cancer, Doctor. Want to just tell us, are there any signs to colon cancer?
Well, actually, the most common symptom is nothing at all.
Right.
So that's the problem with colon cancer. That's why you want to get screened. If you do have symptoms at all, might be rectal bleeding, change in bowel habits, just feeling different, some pressure in your abdomen, things like that.
So what do you need to do to get screened?
You need to go see your doctor.
Okay.
You need to see whether you're at risk for colon cancer and which group you're in. And if you're in one of those groups, you need to go get colonoscopy, screening colonoscopy.
Is that the only process, a colonoscopy, or are there some other things?
Well, that's the gold standard. That's the best test you can get because it not only can detect cancer at an early stage, but it actually can prevent colon cancer as well.
So, Polly, how did you know that you had it?
I had some mild rectal bleeding, and I knew that wasn't normal. So I called my doctor, and I had a colonoscopy, and they found a malignant cancerous tumor. Wow. And I went to see Dr. Cohen and had surgery in December.
And so how's it been going for you?
It's been fine.
Yeah, how was the surgery?
It's
surgery,
It's surgery.
Sure.
Yes,
yeah.
It's surgery. Yes, it is.
But you feel...
I feel fine.
Okay,
it takes some time to recover, yes.
And you've been going through some radiation?
I'm having radiation and chemotherapy as preventive treatment.
What's that process been like?
Well, it just began this week. They usually want you to have several weeks of recovery after your surgery.
Right.
And so far, so good.
Boy, it must be so scary when you hear that you have cancer, right? That word, I mean, you just, you know.
Yes, in some ways it is, I think, but you have to be so glad that you had screening. What if I had not called?
Yeah. Well, what if she had not had called? It would have obviously been worse.
It would have been. At this point, Polly would have probably been doing whatever she does.
Right.
And would have gone on for another 6 months to a year until more symptoms developed. And then she would have come in, and possibly then it might have been an incurable problem. Today, Polly's prognosis is actually quite excellent.
What other symptoms might she have gotten had she not come in to see you?
I think the bleeding would have gotten worse. She would have started having problems moving her bowels and going to the bathroom. And probably belly pain, weight loss, just a whole group of things that you don't want to have and you should look out for.
Well, who's most at risk? Is there a group?
I would tell you that if you live in Connecticut, if you're a man or a woman, and you're 50 years or older, that's the group. That's the group. Exactly. There are some other groups that have high risk, but the key thing is it's really everybody. It's everybody over the age of 50.
What about family history? Does that come into play?
It does. Certainly if you have a very strong family history, you're probably at a little bit more risk. Sometimes we start screening earlier and definitely more frequently.
Did you have any family history of this?
Not any.
None whatsoever. No kidding.
So all the more reason it's important to be screened.
Is there anything you can do, doctor, to reduce your chances of getting colon cancer?
Besides screening, and screening is a wonderful thing, but besides that, leading a healthy lifestyle. High-fiber diet, stay away from the junk food, from the fried foods, a lot of exercise, 2-3 times a week would be great. Definitely stop smoking if you're smoking. That's a risk factor for colon cancer and a lot of other diseases as well.
Wow. All right. Dr. Cohen and Polly, thanks for coming in.
Welcome.
We appreciate it.
Thank you.
We wish you all the best and success. Thanks for providing that. So get screened. That's the key. Right?
Absolutely.
Okay, especially if you're over 50, but maybe even if you're in the 40s, it certainly doesn't hurt. All right. Guys, over to you.
All right. Right now, Logan, we don't have any huge problems. One minor snag was still in the